Mental health has for a long time been a major topic of discussion as many people are continually affected by different types of mental disorders. One of the mental disorders that is now coming to light is the premenstrual dysphoric disorder. PMDD is debilitating, yet largely unexplored. Most people either have limited knowledge or no clue at all on what PMDD is.
Premenstrual dysphoric disorder. This is a mental health disorder or condition classified under the DSM-5, the 5th edition revised text, and it falls under the mood disorders when you talk about the mental health disorders and conditions. So it falls under the mood disorder and particularly under the depressive disorders.
For PMS, you have those symptoms, but you're able to go about your day-to-day things. But for PMDD, it's more severe. So the irritability, the anger, the anxiety, the tension, the mood swings, the fatigue, the poor concentration, all that is so severe that you're unable to go about your work, your school, or your day-to-day. That's the first thing. So PMS, you have those symptoms, you're irritable, but you're able to go about your day and go to work. You may function a bit less, like not as you normally would, but you're still able to take care of your kids, take care of your family, take care of your work responsibilities. But PMDD, you actually are unable to function for that period of time because of the severe symptoms that you're going through.
So if there is an interference of the normal functioning as an individual, that is one of the criteria that we use, like any other mental disorder.
It makes me a totally different person. Most of the time in school, I won't attend classes. I will try to skip classes. I will stay in my room and I'll stay in bed.
The other key thing is that we really need to rule out other existing or conditions. For example, because the PMDD might mimic some symptoms similar to other disorders like depression itself, whether it's major depression or whether it's anxiety disorder. So we have to rule out that. Okay. Then we need also to rule out other drug-induced conditions. For example, maybe someone is under influence or something of the sort. So we really need to rule out that. We also need to rule out any possible medical condition that is, maybe that person might be going through. So when we rule out all that, then we can now say that we are suspecting that this is PMDD, and there is a specific criteria that we have to go through that is guided by, of course, the signs and symptoms.
The signs and symptoms are in two categories. We have the emotional symptoms and signs and the physical signs and symptoms. So the emotional ones include irritability, being angry, feeling sad, having negative thoughts about yourself, feeling anxious and tense, and having mood swings. You have trouble concentrating with whatever work you're doing, and you also have decreased interest in things that you normally would find interesting. Yeah. The physical symptoms would include, also we have food cravings, in the emotional symptoms. The physical symptoms also include sleep difficulties, whether you're sleeping too much or sleeping too little, feeling fatigued, and even to the point whereby you're feeling suicidal, have thoughts of suicide.
One of the risks involved in PMDD is one, if there is a genetic predisposition. You're coming from a family that has a history of this particular condition. Whether your aunt, your mother, your grandmother, or whatever, if some of those people had this particular condition, then there is a high risk of you also developing the same. Two is if you've ever had another mood disorder. For example, you've had depression, you've had anxiety, and what have you, there is also that high risk. And then three, there is the environmental risk. That is to mean stress can cause.
So in terms of diagnosing, there is an actual PMDD checklist that one can use, and it actually classifies the major symptoms and the minor symptoms, but the major symptoms are more focused around mental health. So we look at things like depressive symptoms for patients who have, sense of worthlessness, suicidality around that week before their periods come in, become maybe very combative and are unable to get along with people at home, or they're totally listless, they don't want to get involved in anything. And then other symptoms alongside that can be part of the physical, where appetite, crazy cravings that are out of order, that are completely uncontrolled, or sleeplessness, just sleeping, completely unable to wake up even when there is no reason for it, and such other symptoms. And the physical ones that we know, the bloating, the diarrhea, the pain that can come that's completely unexplained and sometimes may not respond very well to pain treatment. So with that, then you're able to say, keeping a diary for a while, we're able to tell a patient that yes, having been able to consistently demonstrate this for 3 to 6 months means that there's a high likelihood that the patient is struggling with premenstrual dysphoric disorder.
That can be 1 week before my period, so I'll get really sick. Then after 1 week I get my period, and I'm like, so that was the issue. So I'll get cramps a week before, not even a few days before. A week before I'll get cramps. And bloating now is my problem, because I get that before, during the time, like during the menstruation period, and a few days after.
The first thing is to understand that this is not a condition somebody may be able to fully self-manage at home, especially because of the high risk of the depressive symptoms and the kind of morbidity that it can result in. So there is need to acknowledge the need for help. There's a need to actually seek treatment, and the treatment modalities vary. There's what the patient can do at home, which includes diet, adjustments to be healthier, exercise, because definitely exercise releases good endorphins, and that can make the duration a bit more manageable. But importantly, on the medical side, there's a mental therapies. We have what we call cognitive behavior therapy, which can be instituted to help the patient learn to cope better with these symptoms and therefore be able to have a better existence during that period. But additionally, there is need for medical treatment. So we may actually be getting antidepressants. There are different types that have actually been shown to work better than others. They also need medication, hormonal medication, to hormone modulate the cycle. Additionally, then there are pain medications that we give. They are not, so there's a managing the pain, that is period pain, that is one of the symptoms of PMDD, but it's also managing the neural pain that is as a result of the distortion of how the nerves are actually working because of the distortion of the neurotransmitters in the brain. So it's a wholesome package, and the patient has to be at the center of it. They need to be able to understand how these medications work. They need to be able to choose what works best for them, and it's not a one size fits all. Everyone's different, so they have to be able to walk this journey, find what works for them and stick to it.
There are lifestyle interventions as well as the medical part. So what we can do for lifestyle, exercise is very important. Of course, every time you should exercise, whether it's for physical health or mental health, it's important to exercise. But specifically for PMDD, they prescribe aerobic exercises. So that can be things that involve the heart beating very fast, sweating for at least 30 minutes. It can be skipping, can be aerobic classes, can be running, whatever makes you heart pump. That's the lifestyle intervention. But also diet. It has been shown that eating complex carbohydrates will help towards increasing a molecule called tryptophan, which is one of the elements that is important to metabolize serotonin, which is what we're looking for. It goes towards lifting your mood and helping you with sleep. So the foods that you're going to eat that are complex carbs are like brown rice, cornflakes, foods that are complex carbohydrates, as opposed to the junk food.
PMDD is a complex and disabling condition that affects a number of women, most cases going undiagnosed or misdiagnosed, leaving many women suffering in silence.
So by mere fact that it's under mental health disorder, there is that stigma, and that's why you may find that most women may not come out and seek help because of the societal stigma. 2 is lack of knowledge. Lack of knowledge is key, because you may find that women maybe do not know whether this is a condition, a mental condition that needs treatment and care, because they may just think that it's sometimes we normalize things, okay? So there is lack of knowledge. The other thing is, I think the reason why we're not having more women is because maybe we don't have a lot of experts in this area who have specialized in this particular line. Like you are an expert who deals mostly with PMDD. I think it's also very important that we have those people with specific expertise in this PMDD, where women can feel comfortable to come to them, they can seek the professional help that they need.
I honestly think it's more historical and how women have been viewed and how we've always assumed that women's menses come with moods. So there was a long duration of trying to appreciate that there's a difference between regular hormonal changes and the moods they bring as premenstrual syndrome, and that this is pathological, that this has crossed the line beyond what is acceptable. And for even at the point at which it was appreciated, for a long time it was just lumped under it was actually lumped under mental health diseases of otherwise unspecified cause. And that didn't help, because if you're not looking for the specified cause, then obviously you're unable to list it as an independent condition. So yes, now it's been acknowledged, it has actually been put in our DSM-5, but now we need a lot of awareness for people who probably didn't believe in it in the first place, want to accept that it exists, for us to create awareness amongst women, because women have to be aware something is wrong for them to be able to seek treatment. But we also must heavily empower our health workers so that when they come for help, they are actually able to be directed to where they can get appropriate help. But that means that the health worker must acknowledge that yes, this condition exists, this patient may be demonstrating these symptoms, and this is the specialist they need to see for care.
We really need to do a lot of public sensitization on PMDD, for both genders, male and female, to tell them that it's normal. Just like any other mental condition, it's very normal for one to develop this particular condition because of a number of risks.
The prevalence globally has been shown to be around 5% to about 36%. That's globally. In Kenya, a study was done 3 years ago, and it showed the prevalence in Machakos County, and showed the prevalence to be around 31%. And most of the people who were in that study, most of the women, showed that they had a lot of emotional and physical symptoms as their presentation.
We encourage that as an individual, don't do what we call self-testing or self-diagnosis. We encourage people to seek professional help, go to an expert, and in this case, you can look for a psychologist or a clinical psychologist or a psychiatric doctor. They are going to give you expert opinion in regards to that.
If there's someone else going through this, just know you're not alone. There are also people like you out here. We are going through the same.